Hi, this is Dr. Eric Dein from Room Now, talking to you at the end of day one of ACR Convergence 2020, coming to you from Baltimore, Maryland. You have a patient comes in clinic and they have arthralgias for evaluation, and they come in with lab work that shows that they have positive ACPAs. But on physical examination, they have no visible inflammatory arthritis, no synovitis that you can identify on exam. But you have an ultrasound around, you take a look with a probe and you find that they have some subclinical synovitis. How do you treat these patients? Would you start them on a DMARD at this time? That's a fairly common clinical question that comes up in practice, and abstract 0481 from the afternoon oral sessions today looked at subclinical synovitis in positive ACPA patients and asked, how often do they progress to true overt inflammatory arthritis in 1 year? This was a Dutch study that looked at 3 cohorts, SONAR, CSA, and the arthralgia cohort. And depending on the cohort, they each identified subclinical synovitis with imaging, either ultrasound or MRI imaging. And they looked at these patients and followed them and asked, how often would a rheumatologist on physical examination identify inflammatory arthritis after 1 year? What they found was 44 to 68% in the 3 studies showed non-progression to inflammatory arthritis in 1 year. Therefore, they said that ACPA positivity is with some subclinical synovitis. They called it a false positive that does not equal clinical arthritis. And their conclusion on this is that DMARD initiation in the absence of clinical arthritis may be an overtreatment. They recognize that there's a few things that aren't quite known based on that. Do the DMARDs help treat subclinical synovitis symptoms that may be leading to the arthralgias? And the million-dollar question is, can we stop the progression of these patients to inflammatory arthritis? I put a poll on Twitter to see if you would start DMARDs, and over 70% of people said yes, they still would start on DMARDs. And I think it gets down to those issues. I think there's still approximately 50 to 70% of patients that will not have, that will have progression to active synovitis, to diagnosable inflammatory arthritis, rheumatoid arthritis. And for that reason, I think it is very worthwhile to think about early initiation, prevent prognosis, prevent destruction of joints, and possibly even prevent the progression into a diagnosable inflammatory arthritis disease. This is Dr. Dein from Room Now. Thank you very much for your time, and we'll talk to you later. Bye.